describe how to do this. So it's not that the one patients were treated and one group of patients were treated and one group were not treated, not at all. They gave the patients the best available treatment. It's just that some got this extra calcifidiol as well, this vitamin D analogue that raises the blood levels very quickly on admission to hospital. Now, they were allocated 2 to 1, so twice as many people went into the calcifidiol. So they ended up with about 50 people in the calcifidiol versus about 25 people in the control group. Not huge numbers, but the evidence is quite compelling, actually. And they were given oral calcifidiol on admission. If they were given it, they were given 0.532 milligrams, which of course is 532 micrograms. And remember, my vitamin D here is 25 micrograms. So we can see that they were given about 20, the equivalent of about 20 of these tablets. So a fairly substantial dose. And then they were given another 266 micrograms, 0.266 of a milligram on days 3 and day 7. And then they were given that amount, the 266 micrograms, the 0.266 milligrams, they were given that weekly until discharge. And the endpoints were intensive care admission. Did these people require intensive care admission, or were there deaths? Now get ready for these results, because they are, I must say, when I read them, I was taken aback. 50 patients treated with calcifidiol, good. 1 required admission to intensive care, that's 2%. Normally you would be looking at many more than that. 26 untreated patients, sorry, it wasn't 25, it was 26 untreated patients in the control group. 13 required admission to intensive care, 50%. So would you like a 2% chance of being admitted to intensive care? Or would you like a 50% chance of being admitted to intensive care? I know which I'd choose. Impressive difference. Now, even though the numbers were small, this gives a very high p-value. So I always forget these, but 0.1 would be 10% result of the chance that it rose by chance. 0.001 would be 0.01 would be 1 in 100, and 0.001 would be 1 in 1,000. So in other words, there was only 1 chance in 1,000 that this result arose by chance. So pretty impressive data. In other words, to put it another way, they were 999 out of 1,000 sure this was a genuine difference. This is an impressive level of certainty. One chance in 1,000 that it wasn't a genuine result. Of the patients treated with cholecalciferol, none died. None died. And all were discharged without complications. I mean, wow. Wow. These are people that were admitted because they were sick. And they were all discharged, none died, no complications. Now, of the patients that were not treated, only 2 died. But remember, that was after they'd been admitted to intensive care. So these patients were admitted to intensive care. Many more were admitted to intensive care. What were the numbers again? I can't quite remember now. Anyway, many more. It's up there. Look, many more are admitted to intensive care. So I'm always doing that. I'm looking for the data I want, and it's on the same piece of paper. So 2% were admitted to intensive care who had the vitamin D, 50% without. But because the intensive care facilities were good, only 2 of these patients died. So in other words, 11 were discharged, which is, of course, is a significant compliment to the quality of intensive care that they received in this particular Spanish unit, because normally you'd expect a much higher proportion of those that were admitted to intensive care to die than 2 out of 13. But the point is, only 2% required admission to intensive care in the first place in the group that were treated. Right, the conclusion. Calcifidiol seems to be able to reduce severity of disease and all but obliterates the likelihood of going into intensive care. Now, they admit this as a pilot study. Larger trials are needed. Now, if you actually read this study, and of course I've given you the link to it there, if you actually read this study, it is a very, very well conducted study. Everything was done properly as far as I can see, and the statistical analysis was excellent. And they, even though allocation to the two groups of patients was random, they actually went back to check that using mathematical models and were able to make adjustments because of the small sample size, and they worked it all out very precisely. So there you go. That's that result. That's just look at it again. The patients who were treated with vitamin D on admission to hospital, 2% of them went on to require intensive care. Patients that were not treated with vitamin D on admission to hospital, 50% went on to require intensive care. But they were all treated with calcifidiol to increase the blood levels quickly. Quite impressive. And given that we have data like this, which we've suspected for a long time, really, I mean, it's just unbelievable that the World Health Organization and all these other centres we've mentioned aren't doing large-scale clinical trials on this. This is readily available, it costs nothing, and yet it's not being done. And more expensive alternatives are often being used. It really is hard to explain. Now, they do give rationales, the activity of vitamin D receptors. So the rationale, why is this working? Why is this working? Well, there's these vitamin D receptors, signalling pathways. So the vitamin D links onto a receptor, and that starts off a load of internal changes inside the cell. And that leads to reduced acute respiratory distress syndrome. It reduces the cytokine, chemokine storm, which causes the inflammation. All these things are all what they believe is happening. It regulates the renin-angiotensin system. Because, of course, remember, this is involved, it's related to blood pressure, and it's related to the, it's the ACE2, the angiotensin converting enzyme receptor via which the virus gets into the cell. It's modulating neutrophil activity, increasing it when necessary, decreasing it when not necessary. It's maintaining the integrity of the pulmonary epithelial barrier. So what that means is it's making sure that the capillaries in the lungs are not leaky. So rather than having gaps, rather than having gaps between the cells as a result of inflammation, the cells that are rather than having these gaps in the cells that are forming the pulmonary capillaries as a result of inflammation, because normally when there's inflammation, the capillaries dilate, and that means there's gaps, and fluid can get out through these gaps, and that fluid can fill up the alveoli. But they're postulating here that it keeps these gaps tight so the fluid can't get through, which again makes perfect physiological sense. Stimulating epithelial repair both in the alveoli and in the blood vessels, and tapering down the increased coagulability, because we know that the increased coagulability of the blood with the formation of microthrombi is a significant risk in severe inflammatory COVID-19 disease. So there you go, I'm convinced. I would much rather have a 2% chance of being admitted to intensive care than a 50% chance. And of course, in the group that were given the vitamin D analogue, no patients died, all discharged without complication. And I personally consider it unethical that clinical trials are not carried out. Now, the patients in this study were given hydroxychloroquine and azithromycin. That was the Spanish protocol, but that was the same in both groups. But both groups were given that. Both groups were giving antibiotics if they needed it for bacterial secondary infection. So that's their protocol. Separate videos, we've argued about that. But this one is, in my view, the evidence now is so strong, I believe it is unethical not to carry out full clinical trials, and I will call on the Oxford Centre for evidence-based medicine, nice organisations, governments around the world, Centres for Disease Control, World Health Organization, to make clinical trials of vitamin D and vitamin D analogues a priority, because I believe this could save millions of lives. As I said back in January, as I've been saying every month since. There we go. Right, that's the end of that video. I expect you'll experience frustration with me. Now, yesterday we talked about ventilation. Just the importance of opening the windows, getting the through draft, because we pointed out in many shops and other places that we've got lots and lots of mask wearing, perspex screens, physical distancing, hand sanitizing, all the things that we would expect, but very often it's done in a stuffy environment. So I said, I asked people to make me up a bit of a poem. So this has now been done. Well, rhymes and things like that. So let's go through, because we like our trustworthy sayings on this channel, as you'll remember if you've watched it for any period of time. To ventilate or ventilator, that is the question. It's quite a good one. COVID hates when we ventilate. It's no debate, just ventilate. Don't hesitate to ventilate. Keep the virus low, let the fresh air flow. Ventilation to save the nation. Don't be daft, make a draft. Vent to prevent. Oh, very good. I'm useless at thinking up this kind of stuff. Lots of people seem to be really good at it. If you care, get fresh air. Ventilate to eradicate. Ventilate and you'll feel great. Ventilate before it's too late. Don't let the rascal infiltrate. Throw windows right wide and ventilate. Good. Don't tempt fate. You need to ventilate. No debate. You need to ventilate to cut the death rate. It's very good. Ventilate. Don't contaminate. Don't leave it too late to ventilate. Ventilation is the key to get this country virus free. How about ventilate to mitigate? Good. Excellent. Now, one last thing. This is a picture of Jackie. Who lives in Ontario, Canada. Now, Jackie has written us a little poem. Where am I? I'm getting confused with my screens here. There we go. So it's a little poem. Now, I'm not going to do it out because I'm not a rapper or a poet. I'm not going to read that. But I'm going to put it in the description. So if someone wants to, whatever you do these days, do you rap it these days? I've no idea. Or set it to music or something. Then it's there. And if you want to send me that, I would love to play it online rather than me make a complete mess of Jackie's poem. But thank you for that, Jackie. Excellent. These things appear a bit silly, but actually anything that communicates is absolutely fine by me. So there we have it. The evidence has been accumulating on the efficacy of vitamin D in prevention and prevention of deterioration. We know it's an important immunological molecule. We know it's been pretty well ignored by the powers that be, despite the amount of literature in terms of peer-reviewed observational studies, in terms of peer-reviewed correlation studies, now in terms of a peer-reviewed randomized blind controlled trial. We just need a bigger one, then we could be absolutely definitive about this. And in my view, it's unethical that this is not being done. So thank you for watching as always.